Okay, so she came back from x-ray. It was in the right spot. So I'm going to secure it to the patient's gown with a safety pin so it doesn't get pulled out or anything or, moved to the wrong spot. And now we have an order to irrigate. So I'm going to perform hand hygiene, provide privacy, explain to the patient what we're going to do. So we are going to fill this syringe up with 30 milliliters of normal saline, disconnect the suction, and keep this little thing. We're going to clamp the tubing. I'm going to fill up this syringe with 30 milliliters of normal saline.
Other than that,
okay.
Thank you.
So we unclamp this. I'm going to listen for bowel sounds again just to make sure it's in the right spot, see if anything is getting through her stomach, if there's a bowel obstruction or something like that. And then I'm going to put this, attach the syringe to the suction.
Okay, and then turn the tubing.
I'm going to flush 30 milliliters of normal saline. I'm going to explain to the patient she might feel it be a little bit cold in there through the tubing and stuff like that. And then after that, I'm going to aspirate back. So this is just a test to see if the normal saline is in her stomach, if it passed, or if it's still in there, if there's anything else in there. So I'm going to aspirate it back 40 milliliters. So I'm going to document that I flushed with 30 milliliters of normal saline and aspirated back 10 milliliters of gastric contents. So now we are ready to remove the NG tube. So again, I'm going to provide privacy, hand hygiene. I'm going to disconnect it from the suction, turn the suction off, and then I'm going to clamp this end just in case anything is going to come back out this tubing. And then explain to the patient, we're just going to take out your NG tube. So I'm going to assess the nasal cavity, make sure there's no skin breakdown or irritation from the NG tube. Then I'm going to auscultate the bowel sounds to make sure everything is working properly and where it's supposed to be. Okay, so we're just going to take out your NG tube. I'm sure you're probably ready for that. So I'm going to detach it from here. I'm going to give her an emesis basin again, just in case it stimulates any of the gag reflex.
Yeah,
So you might feel a little bit of pulling when I pull off the tape here. Okay, so this is ready to go. Okay, I'm going to need you to take a deep breath in and hold your breath for me. You can tilt your head down. You might feel a little bit of burning. It might stimulate the gag reflex. So I have the emesis basin here for you. I'm going to have my towel ready to go and a tissue for my patient. Okay, 1, 2, 3. Okay, I'm going to wrap it up. I'm going to document how the patient tolerated it. I'm going to document the length that was inserted, or the length of the NG tube that was inserted, the time and date, make sure she needs anything, and give her the call.
Yeah, right.